Hi, everybody. We are going to continue with our lymphatic system lecture part 2. So where we stopped up last time is discussing the two types of defense we have in our body. These two types of defenses are known as innate immunity, also known as non-specific, and adaptive immunity, which is also known as the specific immunity. Now, as the name implies in terms of non-specific and specific, non-specific is going to attack all the pathogens that enter the body, regardless of what their origin is, regardless of how many times our body has been introduced to it. It doesn't distinguish versus one bacteria versus another or virus against another. Versus a specific immunity is going to be very particular about what pathogen it will recognize and attack. Now we're going to go into more details about each of these. So let's just start with the non-specific immunity, which is the first one. Non-specific defense is a fully functional immune system which can be triggered without previous exposure of the invading agent. So if the pathogen comes in, I don't need to have seen it before for my body to trigger an immune response against it. If it sees it, if it notices that it is foreign, it will trigger an immune response against it. Now, this immunity is shortly right after the infection has initiated. If the pathogen has gained access to the body in the first place, it is non-specific in terms of recognition of the pathogen. Again, basically what that means is that it's not going to identify one bacteria against another or a bacteria versus a virus. All it's going to recognize is that there is a pathogen or a foreign agent inside the body, and it will try to destroy it to its best of ability. It also doesn't have memory, which is a really key component where you compare your non-specific immunity versus specific immunity. Absence of memory means that basically if, let's say, you got infected with bacteria 1 today, and you dealt with it, you resolved the issue, you were treated, let's say 2 months, 3 months later, you get the same exposure to bacteria 1 again, your body will not recognize that bacteria. It's basically the slates are wiped clean. Think about your immunity this type of immunity has no recognition of previous interaction with that pathogen. Now, innate immunity or non-specific immunity also works in terms of preventing pathogens from entering the body in the first place as well. So that includes things like physical barriers, chemical barriers. If the bacteria has introduced, it can carry process like inflammatory response. It has protein called complement proteins that are fighting off the infective agent, etc. So the goal here right now, as we go and expand on non-specific defense, is understanding that, again, it is non-specific. It targets all of the pathogens. It has no recognition if it has fought the same bacteria or pathogen previously. It first prevents the entry of the pathogen by having things like physical or chemical barriers. And if the pathogen was able to get access to the body, it fights off to destroy it regardless of the category of pathogen by doing things like inflammatory response and or engaging complement proteins. So what are these components? Physical barriers in terms of preventing pathogen entering in the first place include your skin. Again, skin is the most effective barrier, and mucus lining that is present in your digestive system, reproductive, respiratory system, urinary system, and all of these are basically, the goal is to trap and collect bacteria or pathogens that may be trying to get access to the body. You also have, other than physical barriers, you have what we identify as chemical barriers. For instance, your sweat and saliva contains things like lysosomes. They contain antibacterial components, which is basically killing anything that's trying to get access to your body or is sitting on the surface of your skin. Gastric juices that are present within your stomach highly acidic environment that in many cases kills the pathogen. You have a good collection of bacteria, which we call normal flora, that's found in your mouth and intestine, which makes it extremely competitive for other bacteria to survive in that environment. You also have the oil glands on the surface of your skin releasing components that either weakens or kill the bacteria that may possibly cause harm on the surface of your body. Now, let's say that neither the physical or chemical barrier nor chemical barriers were successful in fighting off and removal of the pathogens, and that pathogen gained access to the body. Then one of the first line of defense we have is what we identify as inflammatory response, which is typically depicted with symptoms like pain, redness, heat or localized heat, and clotting within the site of injury. So what is the purpose of each of these, or why each of these symptoms of inflammation takes place in the first place? So pain. One of the main reasons is you have fluid building up in the site of infection. The fluid built up causes the pressure on the nerve ending, and those nerve endings are basically starts to create the pain. These are called pain receptors, basically. The increase in blood flow to the site of infection causes redness. The reason you increase the blood flow is because you want to fight off the infection by bringing new white blood cells to the site of injury. You have increase in heat. Heat increase has two main functions. One, it slows down the bacteria in many cases from growth. And the second thing is it enhances the activity of your white blood cells. Last symptoms associated with inflammatory response is formation of clots, which basically prevents other pathogens from entering at the site of infection. If it's a reason of, if the inflammatory response was as a reason of a cut to the skin. Another part of the innate immunity, which we mentioned earlier, is what we identify as complement protein. So these complement proteins are what depicted in orange structures right here in our picture. So these proteins literally go on the surface of the bacteria, and they create these really tiny pores or holes on the surface of the bacteria, which is again depicted in green in this picture. Now, as these pores open up the inside of the bacteria to the outside, and the fluid that is outside can easily gain access or enter into the bacteria, causing the bacteria to swell up and eventually burst. So you can literally kind of think about filling up the balloon to its extent that it causes the balloon to burst. These complement proteins allow the extra fluid to come in, causing the protein to grow, swell up, and eventually the membrane will be destroyed. Now, what we have discussed so far, which includes, again, physical barriers, chemical barriers like sweat, oil, acidic environment of the stomach, things like inflammatory response, the redness, the heat, the increased blood flow, complement protein, as in things that are going to introduce fluid into the bacteria and cause them to swell and burst. Everything we discussed up to this point is non-specific. Again, your body is not going to decide what type of bacteria is going to attack. All it's going to look is, this is foreign, this is unknown, this is something that's going to cause harm to me, I'm going to remove it from my body. The other hand, we have adaptive immunity. Adaptive immunity is very particular to pathogens, so it's highly specific, as the other name of adaptive immunity is a specific immunity. It is responding specifically to proteins that are found on the surface of your pathogens called antigens. And these adaptive immunity is most particularly associated with B cells and T cells, which we have discussed in the first part of the immune system lecture. So B cells and T cells are also known as B lymphocytes and T lymphocytes. Each of these B cells and T cells have their corresponding receptors, and receptors on these B or T cells can only identify a specific antigen on the surface of the pathogen. So hence the word specific recognition gives the adaptive immunity its name, specific immunity. So let's go ahead and take a look at this. Let's look at the B cells first. Now, we have talked about B cells being produced in your bone marrow. They're also going to get homeschooled to basically mature. So their maturation is also within the bone marrow. And up to this point, what we end up with, if you guys recall from our notes last time, is you're gonna end up, sorry, give me one second. You're gonna end up with what we, at this point, at this point, you're gonna end up with a mature B cell, but these are identified as inactive. So what happens when there is some sort of recognition? So here is my, let's say, my B cell. On the surface of B cells, I have these receptors that look like this. And let's say I have a bacteria, and these bacteria have these, sorry, I should reverse this, but you get the point, they're the same thing. They have these receptors that are going to technically, again, inversely fit into these spaces. So when you look at this B cell at this stage is inactive. Now, what eventually happens, and this is already written on your notes, so you don't have to worry about them. What happens is these antigens on the surface of your bacteria are going to interact with the receptors of your B cells. So they're gonna fit into those. Now, as soon as this interaction happens, we refer to this as recognition, right? So you recognize, the antigen's going to recognize the receptors on the B cells are going to recognize the antigens, and that recognition is going to change the B cells to what? To active. Now, when these B cells with these receptors become active, what they start to gonna do, they're gonna start to make copies of themselves. So making copies of themselves is called proliferation. So you're gonna end up with many what? B cells. Now these B cells have two categories. Let's say this one, this B cell is identified as memory cells, and these are identified as plasma cells. Now, if I'm looking at them, is there a difference between the memory cells and the plasma cells? No. So what is the difference? Why do I have these two types? My plasma cells are going to be the ones that are going to produce something we identify as antibody. So what is antibody going to do? Antibody is going to go and target what? Target the antigens that we saw here. So target antigens on the bacteria. And it's going to do what? It's going to mark them for, I think, mark for destruction. So Looking at this point, just kind of getting the big picture, guys. You start with an inactive B cells with a particular receptors that is going to recognize a specific antigen on a pathogen, let's say your bacteria. When that interaction and recognition happen, your B cell goes from an inactive version to active, which causes the B cells to start to make copies of itself. These copies are two types, even though by looking at them, there is no main difference between them. Some of these copies are identified as memory cells, and some are identified as plasma cells. Memory cells are going to be responsible for producing and releasing a significant amount of antibodies. Now, these antibodies are inside the body, and they go and target what? These antigens on all the copies of this type of bacteria. It's not gonna go and attack all the bacteria, guys. It's only gonna attack bacteria that have this type of a specific antigen on its surface. Now, when it does that, it attaches themselves to those and mark those bacteria for destruction. Now, what happens to these plasma cells after you have dealt with an infection? These plasma cells gets destroyed. Your body says, okay, you've done your job, you were my army, you got rid of my enemy, now you are free to go disperse. So I'm gonna destroy you. So plasma cells are removed from your circulation by your own body because otherwise it's too much resources, basically. You don't need that army. There is no, basically nothing to fight infection. However, what I'm going to do, what your body going to say is, I'm gonna leave some guards behind. And those guards are my memory cells. The job of my memory cells is to just kind of circulate it in my body and always look for a bacteria that has this specific type of antigen that initiated the recognition. If these memory cells recognize that specific antigen, they're going to send a signal. And what they're going to that signal means is now your body says, oh, the infection's back, the original infection is back. So I'm going to start and produce more plasma cells. Let's get the army back together. Let's get my plasma cells proliferated again. And as a result, let me go ahead and fight off the infection one more time. Again, please do note that at this case, if I didn't have the memory cells, I had to start up here from a B cell being inactive and going through this process. When I'm here, I already have everything. All I need to do is what? Proliferate and start the process all over again. So by having memory cells, it is extremely essential and helpful because I do not need to rely on starting the process from the beginning. So going back to what we were talking about, so the second type of cells that we have is T cells, but you just kind of break the information to little pieces. I'm going to stop here and we're going to continue with T cell immunity, adaptive immunity in the next PowerPoint.